Hannon? Yep, okay.
Very good. Is there a motion to exit executive session?
So moved.
Yes.
Yes?
And I have a resolution to accept the material terms of the One Ohio subdivision settlement pursuant to the One Ohio Memorandum of Understanding and consistent with the terms of the July 21st, 2021 National Opioid Settlement Agreement.
So moved.
Second.
And yes.
And is your light green, Tina, mean that you're not being
They're
recorded on there?
different.
My light being
different.
green
Okay, good.
means I'm on.
You're on.
Chris,
Okay.
good morning. You got a quick request for us?
I do.
It's a process question.
No.
No, actually,
He doesn't. We've moved on, Tiffany.
Oh, okay, sorry.
this is
I'm
actually
sorry.
a construction question and a request to the board. The state of Ohio changed rules several years ago, and the board here is well aware that they've allowed different methods of construction now, design, build, and construction manager at risk, you know, in addition to traditional design, bid, build. And we've been looking, considering different, with every construction job, we consider what is the best procurement method out there. And we have a specific project we're looking at, and this is the Foster's lift station expansion, you know, and also the gravity sewer that goes underneath the Little Miami River. This is the job where.
Which is a very complicated deal, and you guys aren't necessarily comfortable handling all that yourself. You want to outsource that to someone to take the risk?
No, I think yes, we want to use construction manager at risk for this job instead of traditional design, bid, build. We hired Burgess and Nyepel, the board contracted with Burgess and Nyepel for the design. And as we're getting into the design and evaluation different alternatives, it really is apparent here that there's a big benefit to marrying a contractor to that design engineer during the design process.
Can you change processes midstream?
We have, can I address this? We have talked to Adam
real
Nice. We've had conversations with Adam Nice on this, and, have asked him to, make sure that that is is acceptable to do. And, based on our conversations yesterday, he thinks it is, he believes it is, and, he doesn't think there's anything in Ohio Administrative Code or Revised Code that prohibits us from hiring a contractor after you hire the design engineer. So.
I got no problem with it based on your
I don't
recommendation.
either. Got an attorney that says it.
So,
I have a resolution.
So,
I have a resolution to authorize a request for proposals and appoint a review committee for the procurement of a construction manager at risk for the Foster's Lift Station and Gravity Sewer Improvement Project.
and before we vote on that, what?
So I want to clarify, the resolution allows us to go ahead with issuing a request for proposal from construction managers. So we'll go out and obtain pricing from construction managers and also with their background experience. So we'll issue a RFQ or RFP that calls out how to submit. And we'd also like to create a committee to review those forms and to provide recommendations back to the board for your review and approval.
I heard that.
Good. I'm all for that.
Okay,
And yes.
all right, very good.
Thank you.
Thank you.
Thanks, Chris.
Dwayne, thank
So
you.
moved.
Oh, we were doing the
It was the
informal,
yes,
yes.
yes. I just thought it was a resolution.
I took that as an
Oh, okay,
affirmation.
I just-
Yes.
All right.
Thank you.
Thank you.
Dwayne, thank you for coming over on short notice. We appreciate it.
Morning.
Probably an appropriate time to get an update, what's going on, how we looking in the county, what's happening.
Well, I would say, just like pretty much everywhere in southwest Ohio and the rest of Ohio, cases have been on the increase. We assume, or some of the evidence shows that a lot of it is due to the spread of the Delta variant. I think we are at 118 case rate over the last 7 days. That's about a 47% increase. Testing is also on the rise, and the positivity rate is also, so more people are getting tested, but those people getting tested, there's also more people that are testing positive at this point as well. And again, that's true across all of the region as well.
Dwayne? may I
Yes,
ask you a
sir.
Question? All right, so, in terms of vaccinations, does the vaccinations that we've all been receiving, many of us, I'm vaccinated, Shannon's vaccinated, David's vaccinated, and I guess the last data I saw had us, our total vaccinations at 56 or over 56% of our population's been vaccinated, correct?
Well, if you look, yeah, it's right around that. If it's the total population, we're right around 54%. If you look at the population that is eligible to be vaccinated, which would be 12 and up, we're closer to 60%.
All right, we'll talk about that in a second. So, and do you know how many people in Warren County have had COVID?
Those numbers are available on the ODH website, yes.
But I'm asking you, what are those numbers, do you know?
I'm sorry?
Do you know what those numbers are?
I don't have them memorized, but yeah, I know where to
Is
get them.
that, if you added the number of people that have had COVID that have not been vaccinated, do we keep that number?
We do not have that number, no.
So do we have an estimate of how many total people have had COVID and have been vaccinated? So if you took that percentage of the population, are we 70%? Where are we at?
That, Dustin, I don't know if that number is available anywhere, but I've not seen that number as to, yeah.
Is it
That's not a
accurate
question
that-
that's asked when
Okay, is
somebody is vaccinated.
Is it accurate to say that we've reached herd immunity at the point where we're 70% and above with either having COVID and or vaccinated together?
So if I remember what we have as far as our current numbers for the number of COVID cases, I want to say it's around 26,000 is what we've had throughout the entire pandemic. So that's what, 10% of the population. And again, we have no idea as to how many have had COVID and then have summarily been vaccinated, so we don't. know
Because
what
we
that
don't
percentage
know how many people have had COVID that are not reported, because a lot of people have had COVID that they don't even know they had COVID.
is. Correct.
I mean, probably more people have had COVID that don't know it than people that know it.
Yeah, I don't know that for sure, but I know that they have done the serological studies where they're looking at that, where they are calculating that, and that from those studies, it could be upwards of 3 times the number of
Yeah,
people
that-
that are.
that's
reported.
the
Right,
kind of data I've
if
been
80%
seeing.
of people are asymptomatic, a lot of those won't know that they even had it.
Exactly, so my point is this. It appears to me that when you take a look at the people in our county that have been both vaccinated and that have had it, and I take it that, would you agree with the statement that the people who have had COVID have as good as, if not better immunity than people that are vaccinated?
I think what some of the things that I've seen is that people that have had COVID, if they were to receive a vaccine after that, then they get a substantial boost in their immunity.
Yeah, but I'm talking about.
But I don't know that, I've not seen anything that directly says that if you have been tested positive and had COVID, that how your immunity rates against those that have been fully vaccinated.
Okay, so you're not familiar with the data, any data that deals with that topic? Because I've read data that indicates that people that have actually had COVID have better immunity than the people that are just getting
I
vaccinated.
think that's what the Cleveland Clinic just issued a report on.
Are you talking about the preprint article that they had? I know what they were looking at was specifically the healthcare workers, and I haven't looked at that to see if it's went through the complete process of being reviewed, but I know that they were indicating with that immunity that it does seem to be fairly robust. They just didn't have a time frame for that as far as how long it is good for.
Right.
I know the CDC just released an MMWR report. I believe it was just a week or so ago, indicating that people that had COVID and then summarily had the vaccination were, I want to say the people that didn't get the vaccination were 2.5 times more likely to get infected with a subsequent infection. And I'll look that up to see exactly what that was, but that was the new report that I know was just put out.
Okay, so now if you have been vaccinated and or if you've had COVID, do you have any data from Warren County that indicates that the people in those categories, that is people who've had COVID already or people that have been vaccinated, are catching COVID again and or spreading COVID of any variant to anybody?
That are either vaccinated or have had a previous
Uh-huh.
infection?
Yes.
Yes, we've had breakthrough cases, so we have absolutely had breakthrough cases of people that are fully vaccinated that have been,
Next,
Had
how many
COVID.
people in that category?
we don't know the exact number on that because we're only having maybe 60% of the people that are answering the phone, when we're actually calling them, when we
Well,
have
I'm
calling
talking
them
about the people you know about. You can't tell me about people you don't know about. So if you've had breakthrough cases, that is people who've already had COVID and people that have been vaccinated, how many people in Warren County have gotten COVID again of any variant? How many?
I don't believe we have that data ready right now. We'll
But
get
you,
that for
okay, all right. So do you know of anyone in that category who has died?
Not that we haven't had any deaths for quite a while.
All right, no, and no, of any kind. So.
COVID
nobody-
related.
COVID related, no COVID related deaths for how long?
I don't know that exact number. I know it's been at least a month, I want to say.
I
last time
thought
that
it
we
was
had one
several
reported to us.
months.
Yeah, it's been quite a while.
Okay, so now, and how many hospitalizations have we had in the last month?
In the last 14 days, I think we've had 8 hospitalizations.
8, okay. So, why are you guys wearing masks?
Following the CDC recommendation,
Do you think that there is a danger of you spreading COVID to somebody?
and there may be based on the data that has been indicated from the CDC.
Okay, so you're, but what you're telling me is that there's a possibility that even though you've both been vaccinated, that you could get a variant and that you could spread it even though you're not sick.
Correct.
Okay, and the chances of that happening are really remote, would that be right?
I would say that they are very
I mean,
correct.
super remote. So the fact that you guys are wearing masks is based upon some guidelines issued that is based upon what kind of data that indicates that there's any real danger of that occurring? What is the data on that?
So the data was based out of the reporting out of Massachusetts, where they were looking at the cycle times, when they were looking at the vaccinated versus unvaccinated cases. And the cycle times, which is basically how many times you amplify the sample to get the amount of virus, basically to get it to where it crosses that threshold of being positive, were about the same between the two different groups, between the people that were the breakthrough cases, so people that were fully vaccinated, and the unvaccinated group. And that's what the CDC guidelines are based on.
Okay, so obviously in Ohio right now, is it true that there are no current COVID mandates issued by the Ohio Department of Health?
The only ones that remain in place, I believe, are the reporting ones. And there might be some on long-term care, but I haven't checked into those for a
Okay.
while.
But there's no mask mandates, there's no restrictions in terms of businesses and operations.
Correct.
There's no restrictions of any kind, and to your knowledge, you don't see that changing in the next month.
I don't foresee that, no.
I have not
Okay.
heard that.
And in fact, is it also true that in Warren County of the counties in Ohio is one of the highest, the best counties for vaccinations of people 60 and over?
I don't know 60 and over. I know overall, I think we're number 6 in the state.
Yeah. And
Number 1 in Southwest Ohio.
Number 1 in Southwest Ohio.
All right, so, and let's go talk about children now, because they're about to open this up, I guess, for maybe children 12 and below.
There's been some indication of that might happen in the fall.
Why in the world do children need to be vaccinated at all? They're not past, we don't have any really active or any information suggesting that children are in real danger of serious illness from this, is there?
They can still get sick, absolutely.
I'm
But
not
as
saying
far as
that.
when you're comparing them to the other age groups, their risk of severe illness is much lower than other age groups.
I mean, it's astronomically lower, isn't it? I mean, it's so low, there are so few children that have died from COVID that, I mean, it's more danger to get almost struck by lightning or to be die in a car accident or something like that. It's extremely low. And in fact, in those cases where some child has died, in almost every case, isn't it true that there's serious comorbidities going on?
I don't know that for sure. So
Okay.
I can't really speak to that.
So is there any, so if I'm a parent, and you've heard about the problems with youth getting this heart condition the Israelis first came out with, right? Okay, and in fact, there was a young lady that graduated from Mason High School a year, maybe it was, I think she graduated in 2020. She went to Northwestern, and she took the vaccine, and then she died from that heart condition. My guess is she'd be alive today if she hadn't had the vaccine. But if you're a very young person who has almost no risk of having serious illness from COVID, is there somebody looking at why those people would take the risk of this unusual heart condition, which I assume is pretty unusual anyway, but is very serious if you get it? Why would we recommend that they get the vaccine, and when they're not really passing the illness on to other people and they're not in danger of serious illness?
The myocarditis, if you get COVID illness, you also have an increased risk of getting the same heart myocarditis as you do with the vaccine as well. So it's, it's
So,
6 to 1
so
half
you're
dozen
saying
to
that the instance of people, of young people who have gotten the myocarditis is the same danger if they actually get COVID as if they get the vaccine?
I would say it's higher based on the data that I've looked at.
Yeah, but I mean, if you get the vaccine, it's a certainty that you're.
Well, it's not a
you're-
certainty that
No,
you'll
I'm
get
not
it.
saying that certainty you're getting myocarditis. It's a certainty that you're gonna get, that you're gonna be in that danger category. But if you don't get the vaccine, you don't have that danger, and then if, you might not ever get COVID, or maybe, do you think that everybody's gonna get COVID regardless of whether or not they're getting the vaccine or not? Yeah,
there's
okay.
no data to tell us what that.
With regard to schools that are starting up this week, do you have any, recommendation with regard to masks or no masks for school-age kids?
Yeah, we've recommended that they wear masks if they're at risk.
Okay, so what does that risk mean?
It means that a lot of, it's really what we want to talk to them, what we advise them, is to get the vaccine because that offers you the best protection. And if you're not eligible for the vaccine, or if you choose not to get vaccinated, then a mask would offer the protection as it did all last year.
Okay. All right, so if a parent does not want their child to be vaccinated and does not want their child to wear a mask, and can you understand why parents might have that feeling? That they would rather their child not be wearing a mask and not be vaccinated?
I think that's a decision for the parent to make, yes, that they have that ability and that right. And,
Okay.
we also recommend parents talk to their pediatrician or doctor about those types of decisions as well.
Okay, and should the government interfere with the parents making that decision in conjunction with the recommendation of their doctor? I mean, once we've informed everybody, and everybody, at this point, pretty soon, everybody can get this vaccine, but certainly everybody over the 12 can get the vaccine right now, can't they?
That's correct.
All right. And so right now, parents and their children and their doctors can make that decision. And soon, maybe the children below 12 can take it too. But we've now informed the public knows about the risks, they understand this issue. Have we not served the function that we should as a government by giving that information, providing the data to the public and allowing them to make the decision? And the vaccines are free, they can get them, if they're widely available. We're still doing them in Warren County and in other locations, both under our auspices as our health department, and they're still being distributed and available in certain pharmacies and at certain hospitals and doctors' offices, correct?
Yes.
Okay.
Yeah, my, number one, thanks for coming over. Just to give the numbers, I always like to talk about the actual factual numbers in this. When you're talking about there's not many children in the state. Again, one's too many, but bad things happen. Again, the beautiful little girl that died in Mason a couple of years ago from just the flu. I mean, it's terrible, but things happen. It's tragic, it's terrible. for under 19 and younger in the entire state of Ohio, of, I don't know how many people that involves, probably 2 million young people, 7 have died. And this was interesting, under the age of 30, 30 and below, 30 people have died in the entire state of this. Right now, my favorite resource, the Ohio Coronavirus Dashboard, which gives the up-to-the-minute statistics. And again, what I think I've seen and what the doctors I've talked to have confirmed what I'm saying, because I always am hesitant to say things publicly if I don't know at least a little bit of what I'm talking about. Every one of these viruses that we've studied the last 100, 150 years do a couple of things. That they all mutate, correct? I mean, that's, every one of these viruses mutates. Generally speaking, they become more contagious and less deadly over time because the virus is looking for constant host. If it's killing off all the hosts, the virus dies out. So this is not a new thing. And I think at least the doctors I've talked to, this is right in line that this has become hyper contagious to the point of someone that is actually vaccinated and has a less outcome or less severe outcome, but people that have been vaccinated, it's getting more and more common to actually get the virus. Like me, that got the vaccination back in February or March, and I just got coronavirus about a month ago. So I was a breakthrough case.
Thanks for telling us about that, Dave.
Yeah. So I was. So didn't know it until basically I was winding down, but went and got tested and all that stuff, and absolutely. So I was one of those breakthrough cases. Much like the flu, that was my personal experience with it. Congestion, like a bad flu for a few days. But what we're concerned about, I think, is societally should be hospitalizations and deaths. Now all we're talking about is cases, even though this variant is super, super contagious. But yet, I think hospitalizations and death, have they risen? Or at least have hospitalizations risen? Absolutely. But the bogey, the starting point is incredibly low. As of yesterday, in the entire state, we have 1,046 people in hospitals. Wait, that's not, we got 1,000 people in a hospital. That's 3.9% of all people in hospitals actually have coronavirus. Right, as of yesterday, in the ICU, in the entire state, it's 301 people, which is 6.2%. And I think when we used to talk about these at the height of the pandemic, we were talking about 30 and 40% numbers, were we not?
I think it did approach that at the worst of it. Yes,
So,
you're correct.
so these are minuscule compared to what we were. I can't speak for everywhere else in the country, but I can speak to what's going on here, that it's more contagious. And again, from what I was told, it's been months since we've actually had a death in Warren County. And, you know, if in the entire state there's only 1,000 people in the hospital, it's there's area 6, and I believe we're right around region 6. I think we're right around those same percentages. Around 3% of all hospitalizations in Southwest Ohio are coronavirus patients. So that's where we get, and I would ask, did you guys see the study? I believe it was out of Florida, where they actually did the study of the young people wearing the masks and how difficult it is, and from a practical standpoint, how real is it that they're actually wearing a protective mask that that really blocks things out at the top and on both sides? Are they wearing it correctly? Well, number one, is the mask appropriate? Apparently, KN95 masks are like 95% effective. Mm-hmm. Regular masks that most of us are wearing, they said, is about 40% protective, and cloth masks are about 20% protective. That's for people that actually are wearing them correctly. I just saw that study. You guys are shaking your head, so I assume.
I have not been able to, do you know what publication that was in?
No, but
Okay,
I just
I'll look
read
it
it.
up.
I saw it in multiple sources, even though it's not widespread. I saw it in different places. But there was a study, and again, I haven't read it because I'm always hesitant to bring it up unless I've actually read it myself. out of, I think, the University of Florida that looked at young people and they're wearing a mask and said they studied at 8 in the morning and then at 3 in the afternoon. And they said at 8 in the morning they were wearing it and it was iffy on if they were wearing it correctly or what have you. But by 3 o'clock in the afternoon, of the young people they studied, it had a bunch of foreign substances, snot, blood, food, particles. It was just not healthy, really. That's what they were covering their face with. So that's where I think from a layman's point of view, I'm having such a hard time with the mask in school concept of, we have real quantifiable data in Warren County. I think one of the greatest things I was most proud of all of Warren County is during this, every school remained open. And they had hybrid learning models for those families that had unique circumstances, where they said, we've got health compromised either kids or health compromised parents or grandparents. We need to do remote learning. God bless them. That's great, and that was all accommodated. But every school stayed open, so we have real data. During the entire length of the alpha variant, let's call it, the first go-around with this, Mason School District, which is a large district, which was open the entire time, and again, in the real world, how many of those kids are wearing actual protective devices correctly fit? My guess is a small percentage of them. I would say most of them are wearing bandanas, cloths, they're down around their chin when they're talking to their friends, walking down the hall. That's what the educators I hear say is the real world, that very few people were doing it absolutely correctly. And this is the most telling statistic for me. How many hospitalizations, according to Mason School Board, when I just asked them this, how many hospitalizations did they have of Mason School students during the height of what I think is the most deadly and the worst variation of this virus?
I believe it was 0.
It is 0.
Yeah.
Literally no kids even went to the hospital, let alone died. Thank the good Lord that no one died. But no one even went to the hospital. And we had real data on this from the largest school district here that, maybe we could sample others, but that was the real quantifiable data of when it was the worst. When I think, if you guys were kind of nodding your heads that you agree that this Delta maybe is more contagious and less deadly is what we're kind of seeing. Everybody's catching it, but people aren't dying like it was, like people used to from it. I think that's a fair statement. But yet, it's more contagious, so now we're seeing kids catching it, but yet our experience when it was even a more deadly variant, they were catching it then too, none of the kids in Mason actually wound up in the hospital even. So that's where it's kind of like, there's so many proven socialization, and I think we've talked about these in the past. What are these 5, 6, 7-year-olds that are now being asked to leave their families for the first time and get out around other people? And this is how we socialize. And, little Johnny and Susie are coming and they're interacting with each other. How do they do it? Now what are we telling those kids? Stay away from each other. Don't talk to each other. Wear a mask. You're not smiling at each other. You're not hugging each other, certainly. No body contact. And so what does that actually mean for those young people, those children, 10, 15, 20 years from now, when that's what we're going through right now? We've already seen a spike in teen suicides, from what I understand, over the
I
last
believe
year.
that was, I think it was hospital, not people that had completed suicide, but it was more
Attempts.
hospitalizations or attempts. I know the study that you're talking about, correct.
So yeah, I mean, there's a lot of stuff that's associated with what we're doing with them right now. And again, the science says, and the data says, the largest school district in Warren County that was well, I don't want to say completely open. It was completely open. Some chose not to go in attendance, but the vast majority of those students were there. We have real data from the more harsh version of this virus, the more deadly version, and there was no hospitalizations. And so that's where I struggle with this masking issue for our young people when we can see this. But again, people are free to make their own choices at this point. And I think that's what America's really founded on, is individual determination. I'm going to choose what's best for me and my family, and I don't need, government can recommend things, but I don't need government mandating how I live my life. And if it's common sense, and again, I got vaccinated. I tell everybody, get vaccinated. It's an open question of, On young people, I don't know, I'm no health expert on that. But on older people that are at risk, or you're interacting with people that are at risk, 100% get vaccinated. It's worth whatever chance it's coming in. So but is that 100% immunity? My personal experience would say no. You can still, I actually saw a study today, and again, I hate throwing studies at you that, when I'm not an expert on them, but I think the UK just studied some of these very breakthrough cases, and they were saying upwards of like 40% of people that had the vaccination had some level of a breakthrough case. I mean, which I've talked to a lot of people that have been vaccinated since I kind of admitted, yeah, hey, I got it. Oh yeah, me too. But again, the outcomes are better because you've got the vaccination and you're not winding up in the hospital. You're certainly not dying. But again, that's what we're kind of seeing in mass as I look at these numbers, because we've had a spike in cases for several weeks now, right?
It's really over the last week is when it's really, I mean, I think we were 3 weeks ago at like 100 cases during a week. We had like 287 last week. I mean, putting that into perspective, where we were in January, it is still a lot lower.
But
Yeah,
the-
significantly lower.
But the important fact is this, though. The important fact that the public needs to know is that always, throughout this entire process, the people at risk were elderly people and people with comorbidities. Those were the people at
And
risk.
obese people, 3 groups.
Okay,
Correct.
and obesity became like a
It's a
comorbidity.
comorbidity.
All right, so, and we now know in Warren County, the elderly population that we've always recognized as being at risk, 65 and older, in Warren County, over 85% of the people in those categories, 65 and over, it's over 86% 80 plus, over 85% 75 to 79, over 85% for 70 to 74, over 85% of 65 to 69 have been vaccinated, correct? They have protected themselves. And to the extent that people that have been vaccinated may get this variant, we know that they are not getting seriously ill. There's nobody in those categories that's gotten seriously ill or died. Nobody. And so we know that the vaccine not only protects people, but it also, to the extent that they get something, it protects them too from any serious illness. And it was, a while back, the argument was that somehow we got to vaccinate a whole bunch, or we got to keep everybody apart, we got to mask everybody up to help and make sure that we didn't spread it to grandma, grandpa, or some other person. Well, grandma, grandpa are all vaccinated. And if they aren't, it's their choice.
It's their choice.
And it's not like they don't know the truth. It's not like they don't know that this is I believe that the vaccines are safe. The people that are worried about that, I disagree. I think it's safe. I took it. I don't see any reason to believe, based upon the fact that, over 100 million people, well over, maybe 150 million people in the United States have been vaccinated. We now know it's safe. Without the testing that they've been done, just the mere fact that that number of people that have been vaccinated successfully, we now even have real world data as to what's happening with them. And it's justified by what we're doing. So I don't see any necessity, based upon the data that we've got here, to mask up little kids, to put them in masks and stuff like that, because they might spread a Delta variant to somebody who is already not susceptible to serious illness. And
that's right in line with what I think the governor and the legislature and even the CDC was really saying in a lot of cases, was it's up to the local officials, correct? It's up to local people on the ground. You know your community. You know the spread. Is it bad? What's going on? I guess that would be maybe the theme of my position today. Is you guys have been great partners through this entire process. You've been right on the spot. We've had great discussions, even when we've disagreed. We've had really healthy discussions during all of this. I would say that a lot of our local leaders, our school districts in particular, are looking to the Warren County Health Department for some guidance on this. And I would say that the theme of the guidance that I've seen, especially from the state, has been a lot of discretion goes to the local health departments. What are those conditions on the ground?
here's what.
So my point would be I would encourage you to look at the data that we've talked about, that, again, I haven't heard you guys push back on any of the numbers that we've given, that any of the numbers are off base, with the fact we haven't had deaths in a long time. There's very few people in the hospital in Southwest Ohio. And Warren County happens to lead all of Southwest Ohio in vaccinations, especially in those that are actually the most vulnerable. And we have quantifiable data that the largest school district had 0 hospitalizations during the worst of this.
And here's the takeaway. This success is because of the things you all did. It's worked. I mean, one, they developed vaccines at unbelievable speed. They got them out on emergency use faster than anybody ever could have anticipated. You guys executed the program wonderfully. People who are at risk got vaccinated. And the result of all of this is that regardless of the fact that there are increased cases, there are not increased hospitalizations dramatically. There's not increased deaths. In other words, it's all worked. Exactly what we had hoped for has happened. And, I mean, this is a tremendous success story for the worst pandemic that's hit the United States in over 100 years. It's an unbelievable achievement. And you guys are largely to thanks for that in Warren County.
And we appreciate that.
Well, thank you. And, I mean, obviously, our mission, a part of our mission is prevention, and we're always going to preach prevention and try to, you know, whether it's vaccinations for any disease, or whether it's wearing a seatbelt, or whether it's, you know, all the different things that we can do to reduce our risk when we're, actively doing whatever we do throughout our lives, and, you know, and provide that education so that those folks and parents and anybody else can make the decision that is right for their family, their situation, and what they're doing.
Right, and it worked. I mean, you guys have done a good job of informing the public. The state has done a good job. People that want to be vaccinated can be vaccinated. They know the risks. They understand the issues. And you know what? Over 85% of everybody in Warren County over 65 has been vaccinated.
And what I would encourage, again, we did the Mask Monday, tried to give an actual protective device to those that were most at risk when the vaccination program was not available. I'm so proud of that. I love that, hey, instead of this cloth, this, or a bandana, or whatever, a gaiter thing, let's give you an actual protective device that we're giving you. I realize there are certain immunocompromised or kids with certain conditions, or the family situation is such that I'm living with a really at-risk cancer survivor, liver transplant patient, something like that. Can we not give those kids an actual protective device and maybe work with those families that feel most vulnerable? Because again, the vast majority of protecting an individual is for that individual to wear the mask. You know, does it help marginally if someone else is wearing a mask? You know, does that lessen the possibility? Yes, but in this world where I'm making my own free will choice that I'm vaccinated, or all my parents or my grandparents are vaccinated, I'm 11 years old, I don't want to get this, my parents are saying I don't want to get a vaccination, but I don't want to wear a mask every day because of all the other reasons we just went through. But the child sitting in the class with me has serious problems that we're recognizing or what have you. Why would we make everybody do something when it is the one-off? Here's that individual. Let's help that individual, protect that individual. I would encourage us, can we look at getting actual, I don't know if KN95 masks come in children's sizes. I don't even know that.
I don't think they do. I know there have been some companies that have been testing those to see if they're appropriate for children. But for general KN95s, I bought some off Amazon. They were in my house in 2 days. I mean, they are readily available, especially compared to where we were a year ago even.
Correct. So my point is there anything that we can do that, because again, I literally just saw that study that KN95s are 95%, and then it drops to like 40 and 20. To where, is it really even do anything to begin with for someone that's actually wearing it correctly, let alone a 10-year-old or a 6-year-old that you know darn well isn't wearing it correctly all day, every day. It's just not the real world. And so, but yet we're gonna, because the optics make it look good, hey, we care about our kids, we care about this, so we're gonna force them all to wear masks. I just don't buy into the really, it's the theater. And we're trying to do something to make it look like of course we care about our kids. But I also care about the individual families doing what's right by their kids by following what the numbers are in Warren County. And that's everything I'm saying are the actual numbers really in Warren County. And I don't think those are up to dispute, but yet there's still a legitimate, some push. Mason School District got a letter signed by 103 doctors saying, you gotta force all the kids in the district to wear masks. Well, why? I don't understand. I talked to the head of a local health hospital chain, really, and went through this whole discussion, and he said, I can't say what you're saying publicly, but as a father, I 100% agree with you. Literally what he said. He's a doctor with young kids. So that's what, I don't know, are we all just in this period now of theatrics? This is what everybody's, these people actually care about society, so they're gonna do this, so we all better do it.
Yeah, we have no intention or plan to require a mask. I don't think we even have the authority anymore to do that if we wanted to, but I agree with you that there's no reason to require them. I think it goes back to parents making that decision for their family, and if they need to consult with their physician and make the decision that's right for their family based off of their specific circumstances. But we are not going to mandate masks in Warren County.
Based on the totality of the real data, correct?
That's correct.
Thank you.
And we talk with our superintendents every Friday. I know two superintendents that had board meetings this week. We're getting information up to very close to it, where I was getting the data for it and providing it to them, looking at the breakdown for the cases under 18 versus over 18 and what it looks like for a year before and over the past week. So we are, anytime they call us, we're looking at it, even going down to the census tract level to look to areas that approximate districts as well.
Well, again, thank you, gentlemen, for coming over. Any other questions? We appreciate it, but thank you for doing what you're doing. Public meeting, anything else? Great.
Motion to adjourn.
We've got a couple of 11 o'clock appointments if you've got something quick. Very good, thank you, sir.
Thank you.
Heard a motion to adjourn, and yes.